And now let's talk about the name of the variant of COVID-19 virus. In the past several days, there were several reports about the discovery of Thai variant. And this make a lot of people feel offended, especially Thai officials that come out and deny that even though it's discovered in Thailand, but the person that carried the variants actually came from Wales, it's an imported case and such and such. But these names, UK variant, India variant, Brazilian variant, or South African variant, is not the real official name of these mutated coronavirus. They actually have a code name in digit number. The system called Pango, but because somehow it's a bit more difficult for most people to remember or to talk about it because the number all sounds similar when a lot of them together. So the media is starting to give it nickname. Not talking about Thai media only, I'm talking about the media for the whole world, starting to give this nickname, just referring to the place that this first discovered. It's like the Spanish flu in the past, that kind of thing. So, meanwhile, the Thailand has been defending this Thai variant. The Indian government also demanded that social media platform remove all references to the Indian variant of COVID-19, saying that the term is not scientifically accurate and damages the country image. So probably with the same reason. Such reactions has nudged many people to dig deeper into how variants are named. In fact, they are systematic, like I told you, the process for naming a virus and its variant. Most commonly used system for classifying COVID-19 is mutant versions. It's called Pango. It uses hundreds of lineages to reflect how the virus has evolved in each new outbreak. Pango assigns new lineage based on not just the significant mutations, but also other epidemiological events, such as the virus jumping from one location to another. The Pango naming system has been adopted by health authorities worldwide, including the United States, Britain, and India. It uses a code of letters and numbers that point to the relationships between different variants. To the trained eye, codes such as B.1.1.7, better known as the UK variant, and B.1.617, widely known as the Indian variant, show that the variants have certain mutations in common and offer clues to their evolutionary history. Hence, it starts with B.1. Every Pango lineage can be read as family tree. The earliest viruses that first circulated in China are denoted as A or B. As they evolved and spread across the globe, their descendants are marked by a series of numbers. For example, B1 includes the outbreak in northern Italy in early 2020, and is the first descendant of the B to be named. Meanwhile, the variant of concern identified in South Africa named B1.351 is the 351st descendant of the virus that caused the Italian outbreak. So this is a lot of number to digest, and for most people, Pango names are difficult to remember. So therefore, like I said, the media and the public have resorted to use nicknames. The World Health Organization advises against using location-based terms for variants. The advice follows its 2015 guideline on naming a human infectious disease, which cautions against including the name of geographic locations, cities, countries, regions, or continents. Naming viruses after the place where they originate can stigmatize the communities involved. Attacks on people of East Asian origin in the United States appear to rise after then President Donald Trump and others called COVID-19 the China virus. Despite the pushback, several diseases have locations in their name, like we mentioned before, Spanish flu or Middle East respiratory syndrome or MERS. WHO revealed that organization is now poised to unveil a virus naming system based on the way tropical storms are identified. The aim was to avoid stigmatizing and de-incentivizing countries from making their sequencing results public and making it easier for the lay public to understand.